When I came here 25 years ago, we served about 1,200 persons per year and about 75 staff. Last year, we served in excess of 6,500 distinct individuals with a staff of over 320. Now, with that comes innovation. So the big difference I see now is the current research and the current technology and the current philosophy is let's do something now. Let's do something now instead of waiting until somebody has a car wreck, until somebody has a heart attack, until somebody is critically injured. Let's go now and do it now instead of trying to pick up the pieces and treat somebody later.
The ability to access care is difficult. First of all, getting to a clinic, getting to the doctor, getting enough doctors, enough social workers, enough therapists, enough occupational therapists to treat those people that need that type of treatment is very difficult to do. So we place iPads in clients' homes. We place them at the sheriff's departments. We place them at the emergency rooms. And so at any time someone comes in, we can do a FaceTime visit with them with an LMHP, a licensed mental health professional, or if they want to speak to an RSS, we can do that. And so we have the ability now with that technology to serve consumers when and where they need the service.
We utilize iPads agency-wide. We use them a lot in crisis situations in the intensive outpatient center. When somebody lives, in rural Oklahoma, a lot of times they may not be able to get in for a lot of services, and so we utilize the iPad, and they're able to push a button and call and talk to a licensed mental health professional at any time, 24 hours a day.
And then we thought what would be even cooler than that was, what about if we gave iPads to law enforcement? Because they sometimes are the first person that come into contact with these individuals. And if they could have that instantaneous contact with also our clinicians, if they engage somebody in the community, they could either, consult about what they needed to do, what would be the best course of action, or they could actually give the consumer the iPad and we could do a crisis stabilization with them right there.
On the other end of the iPad is our 24-hour unit in Bonita, Oklahoma. It's an intensive outpatient center, and it's either a nurse or a therapist that answers on the other end.
Law enforcement loves this because a lot of times they're not mental health professionals. They're not, but they are the first ones on the scene. And then we offer that service, and it's a face-to-face service, just like coming into the office.
We can streamline a lot of things. Used to be whether you were voluntary or you were non-voluntary, we had one option. This way we have more of an option to be more therapeutic with an individual who really wants help and is able to express that they want help.
I mean, one of the things that we also want to do with our technology is to stop those people that are in recovery or trying to recover from going to jail, because jail is not the best place for them. But I think treatment will work much better than re-traumatizing them.
It's imperative that Grand Lake have a good relationship with law enforcement so that individuals in the community get the services that they need in a timely manner, and so that law enforcement is best used in the appropriate way to serve the community.
I feel like without Grand Lake Mental Health providing these services in these communities, there would be a lot more crisis, a lot more law enforcement, a lot more people going to jail instead of getting the services they need. It provides an alternative for that, and it provides somewhere for people to go. Otherwise, they wouldn't get that treatment.